All right, let's talk about under the muscle and over the muscle breast augmentations. Which one is the best? So the simple answer is there's not a best option. There's just options, and you have to figure out as a patient what makes the most sense for you. And then one thing I'll add before I talk about the two different methods is that your choice of incision is very important in minimizing complications. And so sometimes, especially in older studies, the waters were a little muddy because things were being done from an incision standpoint that increased complications, and it may not have actually been where the implant was placed. It may have been the incision. So it's hard to really flush that out. So let's start with under the muscle. So under the muscle is under the pectoralis major muscle. There's a variety of different ways to do this type of operation. But when the implant is under the muscle protects the implant somewhat from some things. So the first thing is it protects the implant from the raw surface of the breast somewhat, and you're less likely to get bacteria on the implant, which can lead to infection and capsular contracture. The other thing you see with having the muscle on top of the implant is that you're just adding a little extra tissue on top of the implant. So you have more tissue between the implant and the outside world, and that sometimes can lead to a more natural look, especially to the upper part of the breast, because it's a more natural slope and you don't tend to have as much issue with the top of the implant edge being visible. So the downsides of under the muscle. So you now have the muscle on top of your implant. So every time you move your arms, flex that chest muscle, your implant will move. And that's not natural to have your breast move when you move your arms. So in some patients, they're very unbothered by it. Other people are very bothered by it. And it can be really noticeable and that telltale sign that you had a breast augmentation. Now, it's also a more painful surgery when we're messing with a muscle versus not messing with a muscle. So the recovery tends to be a bit more lengthy and a bit more painful, although it's not horribly so, especially with the long-acting numbing agents that we have now. So then moving on to over the muscle. So like I said, over the muscle augmentations are a much easier recovery. You don't have to deal with any of the motion of the muscle, which can be really bothersome for some patients. And a lot of patients just don't like the idea of altering and moving a muscle unless they really need to. Now, with over the muscle augmentations, you can, of course, have a little bit more obvious upper pull. So in very thin women, you're kind of stuck between a rock and a hard place. If you go over the muscle, you can have a more obvious upper pull of your implant. But if you go under the muscle, since you don't have a lot of tissue, you have more obvious muscle movement. And so I've just found that patients tend to be bothered less by the implant being a little bit more obvious and bothered more by the muscle motion. But you'll hear different opinions from different surgeons. Now, the other issue with over the muscle is that there is a higher risk of capsular contracture and infection. I really don't see that in real life, and there are some more recent studies where they've looked at this that really show a very low risk of capsular contracture with over the muscle breast augmentation. So I don't think that capsular contracture concern should be a big reason to drive you one way or the other. So one of the things that always comes up in the comments when I do videos about this is, what about mammograms and breast cancer screening? So there is some evidence that having an implant over the muscle versus under the muscle makes it a little more difficult to screen for breast cancer. But there was a study a couple years ago that showed that this just doesn't really play out in real life. So there was a study a couple years ago where they looked at women with breast implants versus women without breast implants, and they found that women with breast implants, they tend to have their cancers diagnosed earlier and smaller than women without breast implants. But they did see in this study that mammograms are, even with the newer mammograms, are more likely to miss cancers in women with breast implants versus not. And there didn't seem to be a difference between under and over the muscle. So you'll talk to radiologists who are very, very convinced that they see a big difference between under the muscle and over. The ones I work with don't see that difference. So I don't think that should be a determining factor based off the best evidence we have, whether or not you choose under or over the muscle. And then it's just always important to remember, if you are a person with breasts with or without implants, it is so important that you do exams yourself, that you go and see a doctor and have them do exams on you from time to time, and that you do your screening for breast cancer like you're supposed to, because catching cancers early saves lives. So just to review again, like most things in plastic surgery, there is no absolute right or wrong. There's just what's right for you as a patient. So make sure that you discuss all the options with your surgeon and you have a good understanding of why they're recommending something to you and whether that makes sense for you and your body.